Metastasis. Metastasis refers to the process by which cancer cells spread from the primary tumor site to other parts of the body, forming secondary tumors in distant organs or tissues. In the context of lung cancer, metastasis occurs when cancer cells break away from the original tumor in the lungs and travel through the bloodstream or lymphatic system to establish new growths in different areas, such as the liver, bones, brain, or other parts of the lungs. Metastasis is a critical factor in determining the stage and severity of cancer and often signifies more advanced disease. Treatments for metastatic lung cancer focus on managing symptoms, slowing down the spread of cancer, and improving the patient's quality of life. Lymph nodes. Lymph nodes are small, bean-shaped structures that are part of the lymphatic system, which plays a vital role in the body's immune response and fluid balance. Lymph nodes are distributed throughout the body and are connected by lymphatic vessels. In the context of lung cancer, lymph nodes located in the chest, particularly around the lungs, are of significant importance. Lymph nodes act as filters for lymph fluid, which contains immune cells and waste products. They help capture and destroy pathogens, abnormal cells, and other potentially harmful substances. In lung cancer, the presence of cancer cells in nearby lymph nodes can indicate that the cancer has begun to spread beyond the primary tumor site. This information is critical for staging the disease accurately and guiding treatment decisions. The evaluation of lymph nodes in lung cancer staging involves techniques like imaging studies, such as CT scans and PET scans, and may also require biopsy to determine if cancer cells are present. The number of affected lymph nodes and their locations can influence treatment plans, as well as the prognosis of the disease. Causes and risk factors. Unravel the causes behind lung cancer. The primary cause of lung cancer is tobacco smoke, including both active smoking and exposure to secondhand smoke. Smoking is responsible for the vast majority of lung cancer cases. However, there are other risk factors and causes that can contribute to the development of lung cancer. 1. Tobacco smoke. Smoking cigarettes, cigars, pipes, or using other tobacco products is the leading cause of lung cancer. Tobacco smoke contains numerous carcinogens, cancer-causing substances, that damage the DNA in lung cells, leading to uncontrolled cell growth and cancer formation. 2. Secondhand smoke. Exposure to the smoke emitted by others who are smoking is also a significant risk factor for lung cancer. Secondhand smoke contains many of the same carcinogens as direct smoke inhalation. 3. Radon gas. Radon is a radioactive gas that can be present in homes, especially in areas with certain geological characteristics. Prolonged exposure to high levels of radon is a known risk factor for lung cancer. 4. Asbestos. Occupational exposure to asbestos, often found in construction materials and other industries, increases the risk of lung cancer. People who have worked with asbestos are at a higher risk, particularly if they also smoke. 5. Air pollution. Long-term exposure to air pollutants, such as particulate matter, diesel exhaust, and other chemicals found in the air, can contribute to lung cancer development. 6. Genetic factors. A small percentage of lung cancer cases are influenced by genetic factors. Certain genetic mutations can increase susceptibility to lung cancer, particularly in individuals with a family history of the disease. 7. Previous lung diseases. Individuals with a history of lung diseases, such as chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis, are at an increased risk of developing lung cancer. 8. Arsenic. Long-term exposure to arsenic, which can be found in some well water and certain industrial settings, has been linked to lung cancer. 9. Radiation exposure. High doses of radiation, such as those used in certain medical treatments or occupational settings, can increase the risk of lung cancer. 10. Chemicals and toxins. Vaping liquids can contain various chemicals, some of which can release harmful toxins when heated and inhaled. These toxins can potentially damage lung tissue and increase the risk of lung diseases, including lung cancer. 11. Heredity. While rare, some genetic syndromes, such as Li-Fraumeni syndrome, can increase the risk of developing lung cancer. It's important to note that while these factors can contribute to the development of lung cancer, the most preventable cause is smoking. Avoiding smoking and reducing exposure to secondhand smoke are the most effective ways to prevent lung cancer.